Right now, an unprecedented shift in American public health policy is unfolding behind the closed doors of the Oval Office, and it is happening with staggering speed. According to a draft document obtained by the Washington Post, the White House is preparing to sign an executive order that would completely upend the childhood immunization schedule as we know it. The administration is calling this directive the gold standard childhood vaccine recommendations. But beneath that reassuring title lies a mandate that has pediatricians across the country raising immediate and severe alarms. The draft order explicitly directs federal agencies to divide childhood vaccines into three distinct categories and advance them to the maximum extent feasible. The most concrete and controversial element of this policy is the sweeping declaration that all childhood immunizations must be administered at separate medical visits. The administration is taking direct aim at combination shots, specifically targeting the MMR vaccine, which provides simultaneous protection against measles, mumps, and rubella. The White House wants to break this standard, decades-old injection apart, forcing parents to schedule independent doctor visits for every single component. We are witnessing a direct collision between executive political action and the established consensus of pediatric medicine. For over 50 years, the combined MMR shot has been a foundational element of global disease prevention. Exhaustive medical studies, continuous monitoring, and billions of administered doses have consistently confirmed its safety and efficacy. Yet this new executive order is not based on sudden laboratory discoveries, new clinical trials, or a shift in the scientific data. Instead, it is designed specifically to accommodate the beliefs of vaccine skeptics. There is a vocal segment of the population that firmly believes administering multiple immunizations to a child at the same time overloads the immune system and causes long-term health problems. To appease this specific skepticism, the administration is using the full weight of the executive branch to restructure the logistical reality of pediatric care in the United States. They are prioritizing a politically powerful belief system over the practical, proven mechanics of disease prevention. If you want to understand how political decisions reshape our everyday reality and demand independent, fact driven investigations, please consider subscribing to this channel. To understand why this policy is generating such immediate backlash from the medical community, we have to move past the political rhetoric and look at the actual logistics of a pediatrician's waiting room. The current childhood immunization schedule is carefully calibrated to achieve two primary goals. First, it aims to provide maximum immunity to an infant as early as their body can mount a robust defense against severe diseases. Second, it is designed to minimize the number of times parents have to bring a healthy child into a medical clinic. Under the standard schedule, children receive the first dose of the MMR vaccine between 12 and 15 months of age, with a second booster dose administered between 4 and 6 years of age. It is an incredibly efficient system. In a single visit, a child receives a shield against three highly contagious and potentially devastating viruses. Under the directives of the proposed executive order, that single moment of efficiency shatters into a bureaucratic nightmare. By demanding that all childhood immunizations be administered at separate medical visits, the White House is instantly multiplying the logistical burden on American families. Think about what a single medical visit actually requires for a working parent. It involves calling a clinic to find an available appointment slot. It means taking time off work, which for millions of hourly workers means lost wages. It requires securing transportation. It means spending an hour or more sitting in a waiting room, often surrounded by other children who are actively sick with respiratory infections or stomach viruses. It involves processing insurance paperwork, paying co-payments, and covering deductibles. Now, imagine a federal policy that tells a parent they must endure that entire process 3 separate times just to secure the basic protections of the measles, mumps, and rubella components. Doctors know exactly how human behavior operates in the real world. When you take a vital preventive health measure and make it significantly more difficult, expensive, and time-consuming to access, fewer people will complete the process. Pediatricians are warning that if this executive order forces them to separate the vaccines, parents will inevitably miss appointments. Life simply gets in the way of even the best intentions. A parent might successfully bring their toddler in for the measles shot, but when the clinic tells them they have to return 2 weeks later for the mumps shot, and 2 weeks after that for the rubella shot, the drop-off rate will be massive. A car breaks down, a shift at work changes, another child gets sick, and suddenly that second or third appointment is delayed by weeks or even months. During those weeks and months of delay, the child remains completely vulnerable to the viruses they have not yet been vaccinated against. This is not an abstract bureaucratic anomaly, it is a biological window of danger. If a child receives a separated measles shot but misses the mumps and rubella appointments, they have zero internal defense if they encounter those pathogens at a daycare center or a playground. By mandating a system that is intentionally less efficient, the executive order practically guarantees that children will go without protection for longer periods of time, fundamentally increasing their risk of contracting and spreading these serious viruses. The policy creates the exact danger it claims to be mitigating. To fully grasp the stakes of intentionally delaying immunity, we must examine the reality of the diseases this policy plays with, starting with measles. Measles is not simply a harmless childhood rite of passage involving a minor rash. It is one of the most relentlessly contagious airborne infectious diseases ever documented by medical science. The virus can survive and remain infectious in the air of a closed room for up to 2 hours after an infected person has coughed, sneezed, or simply exhaled and walked away. If you are not immune and you breathe that air, you have a 90% chance of becoming infected. Before the introduction of the widespread vaccine, the virus infected millions of people annually, resulting in a devastating toll of hospitalizations, severe complications like pneumonia and brain swelling, and a tragic number of preventable deaths. Because measles is so remarkably efficient at finding vulnerable hosts, public health relies on a concept known as herd immunity. To stop the virus from circulating through a community, approximately 95% of the population must be fully vaccinated. This creates a wall of immunity that protects those who cannot be vaccinated, such as newborns who are too young for the shot, or individuals with compromised immune systems. When an executive order forces parents to spread out their children's shots across dozens of separate medical visits, the inevitable delays and skipped appointments will cause a community's overall vaccination coverage to drop. If that coverage slips even slightly below the 95% threshold, the wall breaks and the virus returns with staggering speed. We have seen this play out in localized outbreaks over the past decade when regional vaccine hesitancy caused vaccination rates to dip, but the White House order threatens to institutionalize that delay on a massive national scale. The dangers extend equally to the mumps and rubella components that the administration wants to isolate. Mumps is highly contagious and can lead to severe swelling of the salivary glands, but its complications are what make it truly dangerous, including potential hearing loss and inflammatory conditions affecting the brain and reproductive organs. Rubella presents a unique and terrifying threat. While the infection itself can be relatively mild in children, it is catastrophic if transmitted to a pregnant woman. Congenital rubella syndrome can cause severe birth defects, devastating heart conditions, profound developmental delays, and deafness in the developing fetus. The medical community combined these three vaccines into a single shot in 1971 for a very specific reason: to eliminate the logistical barriers of multiple visits and to eradicate the circulation of these viruses as comprehensively as possible. Reversing that medical triumph means inviting these diseases back into the gaps created by a politically motivated schedule. This forces us to look closely at the official explanation driving the policy. Why is the administration ignoring decades of public health success? The draft justifies the separation of vaccines by pointing to the fears of skeptics who claim that simultaneous administration overwhelms a child's immune system. But this explanation collapses entirely when confronted with basic observable immunological facts. From the very moment a child is born, their immune system is continuously exposed to thousands of foreign antigens every single day. The bacteria in their food, the microscopic dust in their home, the countless pathogens they encounter when playing on the floor or putting toys in their mouths, all of these elements trigger an active immune response. The human immune system is extraordinarily robust, designed by evolution to handle a massive array of simultaneous challenges. In stark contrast, the entire schedule of childhood vaccines, even when administered in combinations, introduces only a minuscule fraction of the antigens a baby naturally encounters and processes in a single afternoon. From a strictly biological perspective, the combined MMR shot is a microscopic drop in the ocean of what a child's immune system successfully manages every day. Yet, the executive order willfully ignores this biological reality. By officially mandating the separation of shots to appease fears about immune overload, the federal government is effectively validating and endorsing the premise that combined vaccines are inherently dangerous. This represents a profound and troubling shift in how national health policy is formulated. Instead of allowing the Centers for Disease Control and Prevention and panels of independent medical experts to define the standard of care based on rigorous clinical safety data, the White House is leveraging the power of the executive branch to rewrite medical standards based on ideological beliefs. It sets a precedent where political appeasement overrides scientific consensus, fundamentally altering the way medicine is practiced in this country. We must also examine the bureaucratic mechanism of how this order will be implemented. The draft explicitly states that the White House will divide vaccines into three categories and direct federal agencies to take steps to advance them to the maximum extent feasible. This language is incredibly aggressive. While the federal government does not directly issue licenses to local pediatricians, it exercises immense control over the healthcare system through massive funding mechanisms, public health guidelines, and the regulatory oversight of the Food and Drug Administration and the CDC. If the executive branch forces these agencies to adopt and promote a fragmented, separated immunization schedule, it fundamentally alters the resources, mandates, and operational guidance provided to every medical clinic, hospital, and state health department across the nation. And this brings us to a crucial parallel development that reveals how the administration plans to secure its new policies. At the exact moment this sweeping public health order is being drafted, Todd Blanche has just been confirmed as the new Attorney General of the United States. The timing of these simultaneous events in the Oval Office is not coincidental. It is a clear demonstration of executive consolidation. The Department of Justice is the ultimate shield and sword of the executive branch. When aggressive federal policies are challenged in court, and an order fundamentally altering childhood vaccines will undoubtedly face massive legal resistance from medical associations, pediatric advocacy groups, and state governments, it will be the Todd Blanche Justice Department aggressively defending the new mandate in federal courtrooms. The confirmation of the Attorney General ensures that the administration has the necessary legal apparatus in place to enforce its directives and fight the inevitable institutional pushback against a policy that doctors warn will put children at immediate risk. Consider the untenable position this creates for pediatricians on the front lines of healthcare. Doctors dedicate their entire careers to protecting the health and well-being of their patients using the best available evidence. When a parent brings a child into an examination room for a 12-month checkup, the physician knows with absolute certainty that the safest and most effective way to protect that child is to administer the combined MMR vaccine. But under the framework of this new executive order, the doctor may find themselves trapped between their medical training and federal directives. They may be forced to withhold comprehensive protection, advising the parent to return next week for a second shot and the week after for a third, knowing full well that they are intentionally leaving the child vulnerable to infectious diseases during the intervening time. It forces medical professionals to practice bad medicine simply to comply with a political narrative. We are witnessing a dangerous intersection of political ideology and federal authority, where the desire to satisfy a specific skeptical base overrides the practical, proven mechanics of keeping our communities safe from preventable diseases. The draft obtained by the Washington Post reveals a policy that completely fails to solve any genuine medical problem. Instead, it manufactures a massive, unprecedented logistical barrier that will inevitably lead to children going without vital, life-saving immunizations for extended periods of time. The administration has substituted a highly efficient, scientifically validated system with a fragmented, burdensome, and deeply flawed process that virtually guarantees a severe drop in national vaccination rates. The official claim that this represents a gold standard of care simply does not survive contact with the reality of how medical care is actually delivered and experienced by American families. You cannot protect a vulnerable population by deliberately slowing down the acquisition of immunity against dangerous viruses. The evidence proves the combined vaccine is safe, and the severe consequences of ignoring this reality will be borne entirely by families forced to navigate these new gaps in protection. Thank you for following this investigation. Please consider subscribing to the channel for more independent, fact-driven reporting.